we'll continue to introduce you to some of our other neuroradiology faculty members and our newest addition, Dr. Bullion.
Hi, how are you?
Can you tell us a little bit about how you got to Yale, your background?
Oh yeah, I went to UCSF for radiology residency and followed that up with neuroradiology fellowship and followed that up with nuclear medicine fellowship. I also did a T32 here at UCSF where I did research and we actually did a lot of work on biomedical device discovery and interventional radiology. And we discovered this device called chemofilter, and it really helps, it really actually works. It reduces the amount of doxorubicin from the blood, and it has really great applications for potential liver-directed therapies. And when I was trying to decide where to go, I really wanted to go to a place that has a lot of residents and has a lot of, like, a bustling community where we can do research and really focus our research on clinical questions. And that's what we have here at Yale. It's literally a very exciting place. We work very well together. We have great motivated faculty, great motivated residents and fellows, medical students. It's I feel like it's a renaissance for my career being here. I don't know, I really enjoy it here.
Wonderful.
The major projects we work on right now and what we're submitting on is some of them are extension of my fellowship work, which is in pediatric brain tumors. So the current paper we're submitting is on molecular drivers of pediatric brain tumors. The other projects that we're working on is machine learning applications in neuro-oncology. So we're actually developing a database of high-grade gliomas and low-grade gliomas here at Yale. And we've built a pipeline for basically machine learning-based classification of these tumors. The goal is to really incorporate it into clinical practice. And the other thing that I'm working on is in the nuclear medicine section. I am responsible for the clinical trials from nuclear medicine. So we recruited an amino acid imaging clinical trial for metastatic brain tumors to the brain, and we're going to be trying to bring some therapies for glioblastoma, nuclear medicine-based therapies for glioblastoma. So we're recruiting different trials to come to Yale for that. So that's very, very exciting.
Thank you so much for your time.
Oh, thank you.
Look forward to having our residents and future medical students come here and hopefully work with you and push some of these projects through. Thank you so much.
Oh, it'd be great. We have lots of projects.
Thank you, Dr. Zay, for being here with us. We just wanted to highlight some of the faculty members that some of the medical students would have opportunity to work with if they were to choose to come to Yale. So the first question is, could you tell us a little bit about your background and how you got to Yale?
Sure. So I did my residency and fellowship in neuroradiology at UCSF. And then after that, I went to Sloan Kettering in New York City. And I was attending there for 3 years until I came to Yale, and I've been at Yale ever since.
And you were the section chief for a while, right? Here at Yale?
Yes, 30 years, so, right.
Wonderful.
When I came here, I was actually the youngest section chief of any major medical program in the country. So.
Oh, wow, wonderful. And I can say it's been definitely a pleasure to have you mentor me personally, and one of the reasons I came here to train here at Yale. Could you tell us a little bit about, what you're involved in terms of research, and then any committees or organizations you've been involved in nationally and internationally?
Sure. So I made my reputation actually in spine MR. Because when I started, spine MR was still somewhat in its early stages. And so I did a lot of work in things that are nowadays considered very ordinary. One of the things that I did very early on was to use contrast in imaging the spine. And this is not something that had been done actually before, because for CT and contrast, you don't see that much because of obviously the bone in CT. With MR, we could suddenly see quite a bit. And nowadays, of course, this is a very old hat. But in those days, we actually didn't know what using gadolinium in the spine would turn into. Since then, of course, that was a long, long, long time ago. Since then, of course, I've continued to do research in imaging of the spine using different MR techniques to better look at certain things. For example, at Yale, we were one of the sites to develop diffusion imaging in the spine. So we actually did a number of papers and presentations on how diffusion imaging could be used in the spine. Since then, I've also concentrated a lot in pediatrics, looking at how little babies develop and how, for example, term infants differ from premature infants in their development and how they wire their brains.
Yes.
So I've been very fortunate. I am past president of the American Society of Spine Radiology, and I'm past president of the American Society of Neuroradiology, which is the largest scientific society of neuroradiology in the world. And so that's been very good being here at Yale, because what it does is not only does it give us a chance to utilize all the research facilities at Yale, but I could also, when I was in those positions, also help other junior faculty members and residents and fellows to develop projects or develop talks which we could then present at the annual meetings. And of course, I was president of the American Society of Spine Radiology quite a while ago, and president of the American Society of Neuroradiology about 5 years ago. But since then, there have been other faculty members who've been in similar situations. For example, Michele Johnson in neuroradiology here also is past president of the American Society of Spine Radiology, and she was able to get a lot of people involved in the spine meeting earlier this year.
And could you talk about your relationship with the trainees and working with the fellows and the residents, and how that's developed over the years?
Sure. I mean, I think that while our service is very busy, and certainly this is not one of the programs where there isn't enough to do, there's always plenty of volume here because we have a really pretty astounding number of MR machines, something like 15 or 16 in the system. Basically, we still try to have a one-on-one teaching session with the residents and the fellows. Of course, due to COVID, that's diminished quite a bit. But prior to COVID, and hopefully by the time that anybody who is watching this will be a resident here, we basically would sit down with each resident, go through the cases that they had previewed that day, and make teaching points as we went along. So I think that it's been a very good working relationship. We have a lot of faculty members here, and we also have a lot of residents, but we are able to carry on this one-on-one situation, as I said, of course, needless to say, before COVID.
And can you talk a little bit about the variety of pathologies that residents can be able to see? You know, now we have more sites that we cover, but you know, physically we don't have to go to. Can you talk a little bit about that and how that has maybe expanded over the course of your time?
One of the strengths actually of Yale is the pathology. The pathology is very good. It's very well rounded. Unlike some programs which have too much of one thing or too much of another thing, we're very evenly spread out. So for example, when I was at UCSF, which of course is a while ago, so things may have changed, we were very well known at that time for brain tumors. And therefore we had an extraordinary number of brain tumors. However, we didn't always have enough of other things. Here, the pathology is very well spread out. We have a lot of everything without, as I said, having the over-concentration in any single thing. The other thing that we have a lot of, which is very good and which is not that common, is we have a significant amount of pediatrics, because Yale Children's Hospital is, of course, the major tertiary referral center for pediatrics in the state.
Thank you so much for summarizing that as well. And could you talk a little bit about any interests outside of neuroradiology that you participate in?
Well, I always say that I went to UCSF as for my training, and I always say that New Haven is, in a way, sort of the polar opposite of San Francisco, in the sense that San Francisco has a terrific reputation, but doesn't always live up to the reputation in the reality, whereas New Haven doesn't have as good a reputation, but actually far exceeds its reputation in terms of the variety of things you can do here, the restaurants, the theater, and of course, if you want to go to New York is very close, and you can always go for an evening.
And what would you say has been the best thing about being here at Yale?
I think the best thing about being here at Yale actually is I think this is a really, really collegial place. I think everybody gets along really well with each other. There's, compared to other places I've been, there's been comparatively little sort of competition or infighting. There's been a lot of collaboration, both within the department and also with other departments. So that if you have a good idea for a project, people are always willing to help and to jump in. I think that's actually been one of the strengths of Yale, in addition to the clinical strengths.
Any last words you have for the future medical students looking for a position here at Yale?
Well, I came here 30 years ago, and I thought at the time that this would be someplace that I would stay only a few years and then leave. But Yale is really a wonderful place. Not only is the medical school and the opportunities here clinically and research-wise terrific, but Yale itself is really a world-class institution. So you have all the opportunities that not only Yale Medical School, but the Yale University affords. We have world-class speakers who come and talk about everything under the sun. We have art museums that have collections that are really premier, and certainly if they were in someplace like the Midwest, would be like the premier institution in that area. So Yale University itself offers an unbelievable number of opportunities, which I think are all available to anybody who comes here.
Thank you so much, Dr. Zay, for your time. Really appreciate it.
Thank you.
So we'll go to our neurointerventional suite and try to see if we can catch Dr. Johnson, who's part of the neuroradiology department, but also does a lot of the neurointerventional procedures. All right. Hi, Dr. Johnson.
Hey, good morning.
So
See if I can untangle the mask, which is one of the challenges of trying to pretend like you're civilized.
thank you for your time. And we just wanted to highlight some of the faculty members in the department that are doing procedures in neuroradiology. Could you talk a little bit about what brought you to Yale and your background and how long you've been here?
So I'm Dr. Michele Johnson. I'm the Director of Interventional Neuroradiology, and I came here in 1999. So I've been here for just over 21 years. My practice involves interventional procedures, including stroke and aneurysms and vascular malformations, but it also involves diagnostic neuroradiology to include MRI and CT and spine procedures, working with residents and fellows over the course of the performance of and interpretation of those procedures. I love doing teaching, and so I like to give a lot of lectures and a lot of audience participation, so the house staff are involved in the discussion, and there's a lot of to and fro and interaction, which I really find wonderful in my job.
We definitely appreciate that. Could you talk a little bit about, you're involved nationally, locally, and in research, some of the projects you've been involved in and some of the committees? You're the recent past president of ASSR.
So I'm the immediate past president of the American Society of Spine Radiology. I think we hosted the last in-person meeting in February of 2020. Where we were able to showcase young faculty as well as house staff talking about spine, from everything from practical diagnostics to intervention. I also have been working with the American College of Radiology on a mentorship program, and this summer ran a program for women and underrepresented minorities to recruit them from the first and second year medical students to teach them about the radiological sciences, including diagnostic, radiation oncology, and of course interventional.
And what would you say has been the best thing about your tenure here at Yale so far?
So I think the best thing, it's a toss-up between the patients and the house staff. Like, I love being able to see people grow from just coming in to be a radiology resident to going out into practice. And it's so much fun when our trainees that have gone out into practice send a text message or a tweet with an interesting case and say, hey, what do you think about this? It's just like, we know that they remember the experience here.
And any last advice for the applicants, since it will be virtual?
I think for the applicants, it would be, the most important thing is to look for the place that feels like the best fit. look at the social media, look at the way the faculty interacts with the house staff, look at the environment. Frankly, I think New Haven's a great place to live. I raised 3 kids here. So I think that it's a great place to live, it's a great environment, and I think the climate and the collegiality between the trainees, the faculty, and the non-radiology physician and practitioner corps at the hospital is really very good. And so you want to look for that kind of learning environment, because then you're trying to learn radiology, you're not trying to navigate difficult climate or difficult environments.
All right. Thank you so much for your time, and thank you for being a mentor to me as well.
Okay. That's great. Thank you. Good luck to you all.
So there you have it. That's one of our neurointerventional faculty. If you come to Yale, you'll have the opportunity to work with her and get some of those experiences, unique experiences that we provide. That was a tour of the neuroradiology department here at Yale. Just to summarize in terms of what you will be experiencing as a trainee. As a first year, you'll start off with plain films and CTs in the neuro CT reading room. You'll read out one-on-one with the attendings. As you get more advanced, second, third, fourth year, you'll have opportunity to rotate through the neuro MR reading room, where you'll be reading complex cases, perfusion imaging, oncology type cases, and your bread and butter neuro MR cases as well. Opportunities outside of those rotations include mini fellowship that you can do in your fourth year. So you'll be incorporated into the fellow rotation. We have a full-fledged fellowship, 12 fellows, and you'll be taking call along with them and have more responsibilities. Additionally, if you wanted to take some time prepare for practice or neuro fellowship, you can do an evening type shift where you'll get more experience on the more acute cases, trauma cases, CT head and neck, MRs for core compression, just to highlight a few type of cases. The department and the section itself is very open to making sure that you get the experience that you need to perform in fellowship as an attending or in private practice. Additionally, there are residents that come that want to incorporate some neuro procedures. We have a variety of neuroradiology procedures that you can be involved in, whether it's LP, vertebroplasties, injections for rare diseases, intrathecal injections, and you can rotate through that section as well, and it can be organized. We're open to ideas and flexibility in making sure that you understand the basics but can tailor your experience the way you need it for your future goals and endeavors, in addition to research that is available. We hope to see you here. Thank you for watching this video.